Hey guys, and welcome to Pass MA with Dani. Today we're going to dive into 20 certified clinical medical assisting questions to get you guys one step closer to passing the exam. Whether you're testing next week or just starting your journey, these questions are going to sharpen your skills, boost your confidence, and also help you feel ready to crush the certification. So don't just sit back and watch. Go ahead and treat it like a practice session. Pause if you need to. Make sure that you are writing down your answers and test yourself as we go. I'm going to walk you guys through the correct answers, and I'm also going to break down the why behind each one so you guys can actually learn it and not just memorize it. So let's go ahead and get started. Question 1. Which of the following is outside of a medical assistant's scope of practice? Is it A, order additional laboratory tests to confirm the patient's condition, B, document vital signs in the patient's medical record, C, assist in scheduling a follow-up appointment for the patient, or D, provide patient education on medication usage? If you said A, to order additional lab tests to confirm the patient's condition, then you are correct. Ordering additional laboratory tests is outside of the medical assistant scope of practice because it does require the authorization of a licensed healthcare provider, like a doctor or even a nurse practitioner. They have the training and also the legal authorization to make clinical decisions about diagnostic testing. Now, medical assistants can collect samples and prepare for lab tests as instructed by a provider, but they are not permitted to independently order tests or interpret diagnostic results. Question 2. During a routine venipuncture, the patient becomes pale and diaphoretic. Which condition is most likely to occur in this patient? Is it A, hypertension, B, syncope, C, hyperglycemia, or is it D, seizure? Now, if you said B, syncope, then you are correct. Syncope is also known as fainting. This is a temporary loss of consciousness that's typically due to a sudden drop in blood pressure, which actually does reduce blood flow to the brain. Question number 3. A medical assistant is reviewing the progress notes of a patient's record that uses the SOAP format. Which of the following would the medical assistant find in the assessment section? Would it be A, the patient's symptoms and complaints, B, the provider's diagnosis or impression of the patient's condition, C, the treatments and medications prescribed, or D, the vital signs and physical examination findings? If you said B, the provider's diagnosis or impression of the patient's condition, then you are correct. Now, in the SOAP format, the assessment section includes the provider's diagnosis, their clinical impression, or the evaluation of the patient's condition. Now, when we're thinking of SOAP notes, the S in SOAP stands for subjective. Now, the subjective information is the patient's reason for visit. It's the patient's symptoms. It's their complaint. It's what your patient feels. And we call it subjective because it's not measurable. If I have a patient that has a headache, this, again, is subjective information because I can't visibly see their headache. If you have a patient that comes in with back pain, I cannot visibly see their back pain. So again, subjective information. Now, the O in SOAP note stands for objective information. This is that measurable data. Vital signs are considered to be objective. If I take a patient's temperature and it reads at 102.6, I can objectively see that the patient does have a fever because it is measurable. Now, the A in the SOAP note stands for assessment. This is the doctor's assessment after seeing or reviewing the patient. And then the P for the SOAP note stands for plan. This is how the physician plans to treat the patient for the condition that they were diagnosed with. Question number 4. When preparing a patient for a Halter monitor, which of the following actions should the medical assistant take? A, vigorously dry the patient's skin prior to electrode placement. B, use adhesive tape to secure the electrodes in place. C, shave the patient's chest hair to ensure good contact. Or D, apply lotion to the skin before placing the electrodes. Now, if you said A, to vigorously dry the patient's skin prior to electrode placement, then you are again correct. Ensuring that the skin is dry is essential for proper electrode adhesion. Drying the skin thoroughly is going to remove any moisture, oils, or any residue that can interfere with the electrode's ability to stay attached and conduct electrical signals accurately. Question number 5. What is the primary pigment that determines skin color? Is it A, keratin, B, melanin, or is it C, keratin? Now, if you said B, melanin, then you are correct. Melanin is a pigment that's produced by melanocytes in the epidermis of the skin. It determines skin color and also provides protection against UV radiation. Question number 6. Which of the following is considered a normal body temperature range? Would it be A, 95 to 97.5 degrees Fahrenheit, B, 97.6 to 99.6 degrees Fahrenheit, or would it be C, 100 to 102 degrees Fahrenheit? If you said B, 97.6 to 99.6 degrees Fahrenheit, then you are correct. The normal body temperature range is 97.6 to 99.6 degrees Fahrenheit for most individuals. Temperatures below this range can indicate hypothermia, while the values above it can possibly suggest fever or hyperthermia. The ranges of 95 to 97.5 and 100 to 102 fall outside of the typical normal range and may indicate an abnormal condition that could require medical attention. Question 7. What does tachycardia refer to? Is it A, a fast heart rate above 100 beats per minute, B, a slow heart rate below 60 beats per minute, or C, an irregular heart rhythm? If you said A, a fast heart rate above 100 beats per minute, then you are correct. Tachycardia is defined as a heart rate that exceeds 100 beats per minute in adults. And it can be due to causes like factors like stress, fever, dehydration, and also other underlying cardiac issues. If a heart rate is below 60 beats per minute, the term is then called bradycardia. And then we have irregular rhythms. Any heartbeat that is irregular is classified as being an arrhythmia. Now, a normal heart rate for an adult patient at rest, which means they're sitting, not doing anything, is 60 to 100 beats per minute. All right, guys, question number 8. Which method is the most accurate for measuring body temperature? Is it A, the oral method, B, axillary method, or is it C, the rectal method? Now, if you said C, rectal method, then you are correct. The rectal method is the most accurate for measuring core body temperature because it reflects internal body heat. Oral and axillary methods are less accurate due to environmental influences or even patient behavior, like if they're talking or if they're eating. So we know that the rectal method is the most accurate. The least accurate method for taking a patient's temperature is the axillary method, and that's when we're taking the temperature underneath the patient's armpits. And if you are taking an oral temperature on a patient, if they have eaten or drink anything cold or hot, or even if they have smoked, you want to make sure that you wait at least 15 minutes before you take their oral temperature. Question 9. A medical assistant is collecting a urine specimen from a patient for a drug screen. Which of the following actions should the medical assistant take to adhere to the chain of custody for the specimen? Would it be A, seal the specimen container in front of the patient, B, label the specimen container after the patient leaves, C, place the specimen in an unsealed bag, or D, allow the patient to deliver the specimen to the lab? If you said A, to seal the specimen container in front of the patient, then you are correct. To maintain the chain of custody, the medical assistant must seal the specimen container in front of the patient immediately after collection. This process ensures that the specimen has not been tampered with, and it also provides transparency to the patient. Now, the chain of custody is crucial for legal and regulatory compliance in drug testing, as it verifies that the sample remained intact and unaltered from collection to testing. The assistant should also complete any required documentation with the patient present, ensuring accuracy and accountability in the collection process. Question number 10. A medical assistant is checking a patient out of the clinic. In which of the following documents should the assistant locate information about provider referrals or follow-up appointment requests for the patient? Would it be A, the encounter form, B, the CMS 1500 claim form, C, informed consent, or D, the patient's medical history form? If you said A, the encounter form, then you are correct. Now, the encounter form, this is also what we call the super bill. This is a document that's used by healthcare providers to detail the services that are provided during the patient's visit. It typically includes information about referrals, follow-up appointments, tests that have been ordered, procedures that were performed, and also billing codes for insurance purposes. The form also provides a summary of the visit, and it does contain the information necessary for medical assistants to help the patient with scheduling those follow-up appointments and referrals as needed. And I do want you guys to remember that CMS 1500 claim form, this is our standard form that's used to submit insurance claims for outpatient services. The CMS 1500 form is the form that we are sending to the insurance company so that we can get paid for the services that we provided to the patients. All right, guys, question 11. A medical assistant is preparing a patient for a physical examination and is helping the patient into the dorsal recumbent position. The assistant should identify that this position is described by which of the following? A, lying flat on the back with the legs extended and together. B, lying face down with arms at the sides. C, lying on the back with knees bent and the feet flat on the exam table. Or D, sitting upright with legs extended. Now, if you said C, lying on the back with knees bent and feet flat on the exam table, then you are correct. The dorsal recumbent position involves that patient lying on their back with the knees bent and the feet flat on the table. This position is often used for abdominal examinations, pelvic exams, and also when accessing areas of the patient's lower body. It provides comfort and it also allows for easier access to the abdominal region of the patient. Now, for those patients who come in with back pain, the dorsal recumbent position also helps reduce strain in this particular area for the patient. It allows them to relax and just be a bit more comfortable. Question number 12. Which of the following stages of the cardiac cycle on an EKG strip represent ventricular depolarization? Is it A, the P wave, B, the QRS complex, C, the T wave, or is it D, the U wave? If you said B, the QRS complex, then you are correct. Now, the QRS complex on the EKG strip represents ventricular depolarization. This phase of the cardiac cycle is crucial as it corresponds to the ventricles that contract and pump blood to the lungs and the rest of the body. The way that I always remember that the QRS complex stands for ventricular depolarization is because on an EKG strip, the QRS complex makes an upside down V. So I always look at that upside down V and I remember V for ventricle, and that's how we remember ventricular depolarization. Now, with the P wave, I want you guys to remember the P wave represents atrial depolarization. This is when the atria of the heart are actually contracting. Question number 13. The provider is performing a routine rectal examination on a patient. Which of the following supplies should the medical assistant have available during the examination? Would it be A, lubricant and gloves, B, a tongue depressor and sterile swab, C, a speculum and forceps, or D, an otoscope and an ear speculum? If you said A, lubricant and gloves, then you are correct. Now, for a rectal examination, the provider requires gloves for hygiene, of course, right? And lubricant to minimize the patient's discomfort during the procedure. Lubricant helps ease the insertion of the examining finger or the instrument, and this ensures a smooth and more comfortable examination for the patient. Question 14. The provider orders the medical assistant to prepare a tablespoon of medication for a patient. How many milliliters of medication should the assistant draw up? A, 5 milliliters, B, 10 milliliters, C, 15 milliliters, or D, 30 milliliters? If you said C, 15 milliliters, then you are correct. Now, 1 tablespoon is equivalent to 15 milliliters. This conversion itself is standard in both cooking and medical measurements. If you guys are thinking about the cooking aspect, in most of our kitchens, we have 2 different size spoons. We have the big spoons and then we have the little spoons. The big spoons are what we call the tablespoons, while the small spoons are what we call the teaspoons. Now, again, remember, tablespoon is equivalent to 15 milliliters. While those little spoons, the teaspoon, is equivalent to 5 milliliters. So make sure not to get those two confused. All right, question number 15. When using a scale with a height bar to measure a patient's height, which action should the medical assistant take? Lower the horizontal bar gently so that it rests on top of the patient's head. Raise the horizontal bar to avoid touching the patient. Measure the patient's height while seated, or tilt the scale for an angled measurement. If you said A, to lower the horizontal bar gently so that it rests on top of the patient's head, then you are correct. To accurately measure height, that horizontal bar should be gently lowered to rest just on the crown of the patient's head while they're standing straight. Now, raising the bar or tilting the scale would actually lead to inaccuracies. Question number 16. What component of blood pressure measures the pressure when the heart is at rest? Would this be A, systolic pressure, B, diastolic pressure, or C, pulse pressure? If you said B, the diastolic pressure, then you are correct. The diastolic pressure is the lower number in a blood pressure reading, and it does reflect the pressure in the arteries when the heart is resting between beats. The systolic pressure measures the pressure during heart contractions, and the pulse pressure is the difference between systolic and diastolic pressures. We're measuring a blood pressure on a patient. We're listening for thumping sounds. And those thumping sounds that we're listening for are called court cough sounds. The very first thump that we hear, that's the systolic pressure. That's the very top number for the patient's blood pressure. And then you'll kind of hear the numbers fading out, and they'll get a little bit lighter. And then the very last thump you hear is the bottom number of the blood pressure. That's the diastolic number. So systolic is the top number, diastolic is the bottom number. Question number 17. Which of the following techniques should a medical assistant use when passing the provider a scalpel during a sterile procedure? Would it be A, make sure that the blade is sideways on a separate Mayo stand? B, blade should be up using forceps to pass? C, blade down, handle first? Or D, blade capped using a skin retractor to pass? Now, if you said C, blade down and handle first, you are correct. When passing a scalpel during a sterile procedure, the safest technique is to pass it with the blade facing down and the handle first. This allows the provider to securely grasp the handle without risking contact to the blade. This minimizes the chance of accidental cuts or contamination. Question number 18. Which of the following is the reason a medical assistant needs to know which test the provider has ordered prior to preparing a blood draw? A, transportation time to the lab. B, type of needle equipment used. C, correct tubes to draw. Or D, to identify the patient. If you said C, the correct tubes to draw, then you are correct. Knowing which test the provider has ordered is essential for the medical assistant to select the correct tubes for the blood draw. Different tests do require specific types of tubes with various additives. So to preserve the blood sample and ensure accurate results, we want to make sure that we're following the correct order of draw. Using the wrong tube can actually lead to incorrect test results because some of the additives from the previous tubes can roll over. Question 19. A medical assistant is confirming that a patient is in the basal state prior to a procedure. Which of the following responses by the patient is acceptable? A, I have not eaten anything in 12 hours. B, I have not voided for 4 hours. C, I have not slept for the past 8 hours. Or D, I have not taken any medications for 10 hours. If you said A, I have not eaten anything for 12 hours, then you are correct. The basal state refers to a fasting state generally defined as having not eaten for at least 8 to 12 hours. This ensures that the patient's metabolic processes are stable, allowing for accurate results in procedures or tests that do require fasting, like blood glucose or lipid panel tests. The response indicating no food intake for 12 hours is the best confirmation of the basal state. For example, if you are doing a cholesterol test on a patient, we want to make sure that they're in the basal state. If they forget and that morning they may go to IHOP and they have some bacon and sausage and fried eggs and all of this type of fried greasy food, what's going to happen, it's going to cause their cholesterol levels to be elevated. So it's going to give us an inaccurate reading if we proceed with the labs without them being in that fasting or that basal state. So we want to make sure that we are getting an accurate reading for our patients. Last question, you guys. Question 20. A medical assistant is preparing to administer an eye solution for irrigation. After verifying the provider's prescription, which of the following actions should the assistant take next? A, ensure the patient's in a seated position. B, check the expiration date of the solution. Or C, disinfect the patient's lower eyelid. If you said B, to check the expiration date of the solution, then you are correct. Now, after verifying the provider's prescription, the next crucial step is going to be to check the expiration date of the solution. This ensures safety and also effectiveness. Administering an expired solution could be an ineffective method or harmful to the patient. So verifying the expiration date is a standard safety practice before using any type of medication or solution on the patient.